Hello everyone, my name is Dr. Ashraf and today we will be doing a case presentation on myocardial infarction that has been induced by the use of cocaine. So the patient will present with new or worsening chest pain, exactly like a typical chest pain by myocardial infarction. It would be retrosternal, squeezing in nature, or it could be a pressure-like pain. The pain would radiate to the arm or to the neck. They can have dyspnea, shortness of breath, and it would worsen by exercise. They will also give you a history of recent use of cocaine. The pain will be relieved by rest or nitroglycerin, and they can have vasovagal symptoms like vomiting, syncope. Of note, the patient will have anxiety or they would be agitated. If you ask them, do you feel any heart racing? So they would say yes to that. Maybe they would say no, but this is one of the typical presentation of cocaine-induced myocardial infarction. So dizziness, nausea, they can have like atypical features as well, like epigastric pain, back pain, burning or stabbing pain. So especially if they are females, diabetic or elderly. But usually this case would be from someone who would be young. Physical examination is very important. So you have to do a complete cardiovascular examination, but you have to pay some attention to detail on the orientation. How is the cognition of the patient? Is there any altered mental status present? So as soon as the examiner asks you to do a physical examination, you have to mention that my patient looks alert, oriented to time, place, person, and I'm going to examine the pupils of my patient. So pupil is very important as well as the skin findings. So you can mention that my on general appearance, my patient looks anxious, agitated. Is restless, or there you can also look at the nasal septum to look for signs of perforation. um, and you can ask your examiner, can I have the vitals of my patient? So it can be often elevated, hypertension, and then tachycardia can be present, tachypnea can be present, and hyperthermia can be present. So you have to do a complete cardiovascular examination. You have to listen to the heart sounds. S3 or S4 can be present. And then in the end, mention that I will do a complete CNS examination and I will look for signs of track marks if there is any suspicion of IV drug use. So what is your next step? So what you can do is that you can ask for urgent stat ECG, a 12 lead ECG. And then for the recent cocaine ingestion, you have to order a urine testing for cocaine, and then troponin as well. So make sure you say serial ECG, serial troponins, chest X-ray, and these are the basic metabolic profile that you have to ask for, like CBC, BUN, creatinine, electrolytes, serum lipids as well, 24 to 48 hours. In within the 48 hours, and also you can ask for an echo. One thing I just realized that I should put in about the other toxicity profiles, like ask for acetaminophen levels, salicylate levels, and ethanol levels as well if you are suspecting a patient who has been coming to you after a cocaine use. So this is how you see an ECG. So like a typical myocardial infarction, you will see ST elevation MI, or it can be a non-ST elevation MI as well. So the treatment, you have to give the same things as you do in a typical myocardial infarction, like aspirin. But in addition, you also give a benzodiazepine to the patient, and then nitroglycerin for persistent hypertension. If the patient is at high risk, you go for a primary PCI, and similarly as you do with a patient of infarction. Avoid beta blockers. Please announce this. Avoid beta. I would not give my patient beta blocker. Um, and then you'll start your patient on a statin. If there is high blood pressure, this is all discharge therapy, so this is long term treatment. um, and then but usually you give like aspirin, benzodiazepine, morphine, oxygen, nitroglycerin. um, and then you also do a drug abuse counseling for your patient. So please announce that I would give benzodiazepine to my patient and I will not give beta blocker to my patient. So these are the important takeaway points. Um, I hope you found this information helpful and learned something new today. Please subscribe to my channel and have a good day.